Have you been diagnosed with a disc herniation and you've got radiating pain? Either a disc herniation in your neck with pain down your arm or a disc herniation in your lower back, pain down your leg? Have you wondered, is surgery your only option? Don't worry, you're not alone. This is a common question that we get in our clinic. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation. I'm fellowship trained in primary spine care. In addition to my training, education, and experience, managing patients with disc herniations and radiating symptoms is something that we've been doing for years. Now, please remember, these videos are for informational and educational purposes only. They are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. So let's dive into this topic. You know, disc herniations and radiating symptoms is a very painful condition, and it's somewhat common. These tend to be conditions that are really difficult for patients to recover. And some patients never fully recover, they just get better. And in some studies, the estimates are 50% improvement is considered to be a good outcome. So in this video, we're just going to take a look at what are called outcome studies. These are studies that looked at large populations of people, looking at to see how did they respond, looking at different forms of treatment. So this is not designed to be something that's specific for you, but it kind of gives you an idea of what you can expect down the road. So there was one study where they looked at, I'll be looking down at some paperwork, at some notes that I have of some of these studies. There was this one study where they looked at approximately 460 patients that had low back pain and pain going down their leg. And they followed them over several years. And what they found at the end was that the success rate for surgery was somewhere between 49 to 58%. So that means even following surgery after about 2 years, around 50% still did not have good resolution. If we take a look at another study, this was one where they look at disc herniations over in the low back symptoms over a 10-year period of time. In this one, patients that had surgery in the study, about 25% of them went on to have a second surgery. They followed these patients over time, and they found that even the ones that chose not to have surgery or did not have surgery, they still ended up having some level of surgery later on down the road. Despite all of these differences, they looked at patients with surgery and without surgery. At 10 years, their ability to work and their disability, that means that the interference that the pain had in their day-to-day living, at 10 years, it was almost identical, whether they had surgery or they didn't have surgery. That's somewhat of a discouraging study, isn't it? We looked at there was another study where they looked at what's called spinal stenosis. Stenosis is just where there's a hole or a channel where nerve or nerves have to exit through, and that hole is closed off. That can be from something soft, such as from a disc herniation, or that can be from something hard, such as arthritis. So that's called stenosis of the spine. At 10 years, 23% of the surgical patients had undergone another surgery. So among patients that had stenosis at the 8 to 10 year follow-up, the low back pain relief with the leg improvement was greater in patients that had surgery, but it wasn't all that much greater than those that had no surgery, that just went on to manage their symptoms. There's another study that was done where they looked at patients, this time we're not going to be comparing surgery, but we're going to be comparing different forms of non-surgical treatment. So there was about 140, about 200 patients that were studied that were given the option of doing education, back school, that were given chiropractic treatment, and they took a look at them. Short-term, long-term improvement. More pain relief was found with the patients that had chiropractic care than the ones that had education, and also the ones that had physical therapy. So the hands-on treatment from a chiropractor provided more relief in this study. Another study that was done with patients that had issues in the neck radiating down the arm, so cervical symptoms with cervical radiculopathy. These patients were treated only with chiropractic care. How long did it take for them to get better? Well, the range was anywhere between 6 visits to around 35 visits for them to get what's called statistically significant, or what that would mean is that the patient was happy with the amount of relief that they had. So the relief can be had, but it didn't really talk about how many of them had recurrence. So at the end of the day, when we take a look at should you have surgery, should you not have surgery, that's between you and your surgeon. And this is a very common question that we have, so we decided to do a video on it. At the end of the day, it's about 50%. That's what we tell our patients. If you have really bad disc issues where the nerves are being interfered with and you have symptoms down the arm, 50% reduction in symptoms is a reasonable result if you do non-surgical care, and seems to be a reasonable result if you do surgical care. Anything more than that is really a wonderful outcome. So hopefully this doesn't apply to you, but if it does, we want you to understand that really good management is what's the most important, and there is not a one size fits all, and there is no guarantee that any type of treatment will be a permanent solution. I hope you found this video helpful. I know you have a lot of videos to pick from. If you have any more questions, we are more than happy to answer those questions for you. If you live in the Minneapolis-St. Paul area, we invite you to come in for an evaluation to see if chiropractic treatment can help you with your recovery. You have many videos to pick from. I'm honored that you chose this one. And until we meet again, have a blessed day.